My name is Emily Kacprzak, Externship Rotation B, and I am conducting my externship at the Center of Revitalizing Psychiatry found in Sarasota. This presentation covers the various requirements alongside the general information about the profession known as psychiatry. Psychiatry has a very complicated history. The term was first seen in the early 1800s, becoming known as a medical specialty. Before this time, doctors would bleed, isolate, and even perform exorcisms on patients, as they had no real knowledge of mental conditions. During this time, treatment was often ineffective and extremely inhumane. Psychiatrists did not treat outpatients until the 1900s. Instead, they focused on those in asylums and hospitals. In the early 1900s, psychiatric treatments such as lobotomies and electroshock therapy became popularized. By the 1950s, laws and regulations were created, leading to the more modern and humane psychiatric treatments that we can observe today. The first step to becoming a psychiatrist is acquiring a bachelor's degree. You should take undergrad courses in various sciences and mathematics in order to meet and help with medical school admissions requirements. Then you have to get into and finish medical school. It takes 4 years in medical school to earn your Doctor of Medicine or Doctor of Osteopathic Medicine degree. After completing medical school and acquiring your degree, you have to complete a residency. Participating in a residency in a clinic or hospital is necessary in order to receive proper training and practice. Then you have to obtain a license. You can get a license through the medical board of whichever state you are practicing in order to be able to freely practice throughout the nation. As a student, you can take extra courses in math and science during your undergrad years in order to speed up the process of medical school and to help with passing the MCAT. As a psychiatrist, you can become board certified through the American Board of Psychiatry and Neurology, which is optional, but it demonstrates your competence and can even improve further employment opportunities. The average annual salary for a psychiatrist is $215,000, and it can range anywhere from $193,000 to $241,000. The lower 10% of psychiatrists will make around $172,000, and the top 10% will make $264,000. Salary can depend on the type of psychiatrist that you are. For psychiatrists, the highest paying job offers come from either states with large cities and large populations that can match the high demand for psychiatrists, such as California and New York, or states with smaller populations like Alaska, Wyoming, and Iowa, as they have fewer psychiatrists available to treat patients. 3 local examples of well-known psychiatric offices in Sarasota include Bayside Center for Behavioral Health, which focuses majorly on inpatient programs and group therapy, Comprehensive MedPsych Systems, which has great interactive therapy sessions, and Coastal Behavioral Healthcare, which offers behavioral health for both children and adults. Each of the 3 previously mentioned mental facilities deal with anything from substance abuse to anxiety to depression. However, only Bayside Center for Behavioral Health offers treatment for more severe mental conditions, such as schizophrenia and multiple personality disorder, as they are actually a branch of a licensed hospital, which is Sarasota Memorial. Being a psychiatrist comes with many advantages. Psychiatry is one of the highest paying jobs, allowing for financial security. The job is also in high demand, so psychiatrists do not need to be afraid of their jobs decreasing. There are also many opportunities presented, such as operating under a psychiatric facility or choosing to have a private office, allowing for flexibility. There are, however, several disadvantages to the job. Sometimes patients can call with emergencies, causing psychiatrists to have to be ready to work on the go at all times. Work might become stressful, as many patients' worries can take a toll on the doctors, and some patients might even prove to be a danger to the psychiatrist, acting aggressively at times. A psychiatrist's lifestyle can prove to be hectic due to work. The average hours worked tend to be around 48 per week. Psychiatrists normally don't travel as they see patients in office, but if you work at more than one location, you might have to move between them. You also have to be prepared to hear stories that might make many people uncomfortable, but that's your job as a mental health doctor. There are many programs offered to medical students. The University of Florida has a psychiatric program with elaborate teaching schedules to give students a large scope of information. Their acceptance rate is around 4%. Miami's Department of Psychiatry and Behavioral Sciences teaches the highest quality patient care and offers unique experiences in the field. Their acceptance rate is around 2%. The best psychiatric program, however, is offered by the Department of Psychiatry of Harvard Medical, which is the best-ranked program for students studying psychiatry, as Harvard is one of the top-ranked colleges in America. The program offers various research opportunities and insight from 9 teaching institutions. Its acceptance rate is 3.7%. I work at the Center of Revitalizing Psychiatry. They offer many programs for people of all ages, as they have doctors who specialize in specific age groups. The psychiatric office also has one of the most intensive outpatient programs, which allows patients to come in, have meetings with psychiatrists and psychologists, and then go home. Throughout my externship at the Center of Revitalizing Psychiatry, my responsibilities have included filing patient information, organizing doctor schedules, logging patient hours, and speaking to psychiatrists about patient organization. By helping in these areas, I get to observe how psychiatric offices are run and organized. For psychiatric offices, whether they're privately owned or government facilities, stakeholders can include those that offer donations, the individual employees, and the business manager. Due to the fact that all offices are very private, they do not disclose such information, and so I was not told any specifics from my workplace. A lack of proper treatment for those who have mental conditions is a major flaw in today's society. My employer and those that work at the Center of Revitalizing Psychiatry play a very important role in the community, as they bring help to people who request it. They offer affordable treatments in a variety of treatment types in order to suit each patient individually as accurately as possible. All of the psychiatrists that work at the Center of Revitalizing Psychiatry have an MD, as they are all licensed doctors. Other therapists can be a licensed mental health counselor, licensed clinical social worker, licensed professional counselor, Master of Science, or Doctor of Philosophy, as they are not required to attend medical school.